Thanks, Shal. I really appreciate that. It's kind of funny, too. About 4 years ago, when I first started as Chief Deputy Director, I met Andy. Toby Ewing from the Senate actually introduced us, and he was talking about open data. I didn't really know what that was. I just knew that when we came on board, we really wanted to get the data out there, but we'd never heard the term open data. So when Shal talked about us being the pilot, we were just really jazzed and excited. And when we heard that there was money attached to it, that got us even more excited. So what I'm going to talk about is how, what our open data journey is. Let's see, oh, they changed the presentation there. Okay, I'm going to go over 3 different areas. One is, our vision. Why open data for us in public health? What could we get out of this? And, what did we look like a year ago? What was our vision for the future? We also want to talk about our journey. What transpired over that year? How do we overcome our perceived barriers? And what was some of the impact and some of the use cases of the data that we opened up? Also want to talk about our portal and beyond, what our portal looks like now, and how we've kind of generated a ripple effect that's gone beyond just our department and is really encompassing the entire California Health and Human Services Agency. Okay, so our department has tons of data. We have data on vital records, we've got data on birth defects, teen pregnancy rates, tobacco use, healthcare facilities, on and on and on. But the data is really hard to find, okay? So you can't really know where all this data is. Once you find the data that you want, it's not easily extractable. A lot of the data that we have is in PDF format. And then if you can actually extract the data, you don't really necessarily know what it means. Are you making apples to oranges comparison? What is this data element? What's the definition of that? So we realize that, with public health, so much of what we do requires data, knowledge of data. And we have it accessible, but it's really not that easily available. So just so you know, this is what our website currently looks like. As you can tell, this is really hard to follow. It's hard, you can't filter through this, you can't sort it. You'll see that there's a lot of PDF formats, and our data is in a bunch of different web pages, so that it's not all in one place. So one of our goals was, okay, let's just make the data more accessible. And so if we were going to be more transparent, we felt that by being more transparent, we were going to provide access to data in a way that the public can be much more informed. They can make better decisions, and they can hold us more accountable. And together we can make change as a result of that. We also wanted to promote collaboration. By providing all this data, we could work within our own programs in CDPH, but also between departments, and also between different levels of government, and also with the local communities. And we thought that all of that would generate a lot more participation, a lot more engagement of the public, and then we can also get feedback and input from the public and from other stakeholders to improve the data that we have. So what do we do? Our journey. We had some lofty goals, but we had to figure out how are we going to get started? What do we need to do? Because these were the kind of things we thought about. There were a lot of perceived barriers to open data. One, it's going to be too expensive. How are we going to afford this in the midst of all these budget cuts? It's too much work. Even if we could afford it, who's going to do this? We can't just ramp this up. This is going to take a lot of dedicated resources. And then if we do ramp this up, what if the data is bad? It's dirty. Some of the data may not look so good. People might draw the wrong conclusions from the data that we present. And what if the data makes us look bad? What if people see that the trends are going the wrong way? How's that going to look for us as a department or as a state or as an administration? And then how are we going to get all of this approved? Some of this data could be very controversial. What's going to be the approval process? Is that ever going to happen? Are we going to invest all this time and effort and find that this is going to get shut down? And then finally, will anyone actually look at this? We do all this work, and is it just going to be a couple of folks who are going to look at this data, or is the public really going to make some use out of this? So the first nut we cracked, too expensive. Well, we had the generous support of the California Healthcare Foundation. They've been a true partner for us. And more than just providing seed money, that was helpful, but what was really helpful was they helped with the procurement process that sped things up really quickly by having them work on that end. But they were also a catalyst and a collaborator for us. We kind of saw them both as a muse and motivator, because now that we had this external source funding us, it kind of put some pressure on us. Hey, we got to deliver. We're on a timetable now. So that really helped us get things going. As far as too much work, we were very fortunate to have the visionary leadership of Dr. Esty Garrity. She was then our deputy director for the Center for Healthcare Statistics. Esty served as our coach, our quarterback, and our cheerleader. And I know we would have done open data without her, but not nearly as quickly as we did. So thank you, Esty. We also had a very small but really dedicated team of folks who were really interested and enthusiastic about open data. Some of the CHISI staff, Ellen, Scott, and Carla, really worked on the technical aspects and helped with execution. We also borrowed someone, Tamara, from one of our centers, and she had connections galore with the larger civic hacker community. And then I served as executive sponsor along with Kathy Billingsley, so we were able to really make this a departmental priority, and along with support from our director's office staff. The other thing that really helped is we did not reinvent the wheel. We basically stole the Open Data Handbook from New York and used that and just tinkered with it to make it our own. So having all of those really helped speed up the process. The data's dirty. Well, what we did was we instituted a rigorous data evaluation process to ensure consistency and accuracy with the data, and also to identify if there's any risk with publication. We defined terms, and this is kind of the format we came up with, where we had to be very rigorous about this process. And in fact, we found this to be a real quality improvement project for the department, because we weren't doing this with our data, and we were putting it out on our website, but we weren't following these rigorous standards. So we developed metadata standards, data about data, and we've got all of that posted now and available for the public. We will look bad. Well, some of the data shows we're not making as much progress as we'd like, but that's not necessarily a bad thing. It actually spurs us to do better. And then we're also finding that putting the data out is actually generating better outcomes. So for example, it's kind of hard to tell from this, but you'll see on your left side the map. The dots there represent different hospital locations in California. And right now on our website, we're going to put this on our open data portal soon. You can click on one of those dots, and you will pop up to your top left or top right that hospital, and you will see the healthcare associated infection rates for that hospital. And you can compare that hospital this year versus last year, and you can compare it against other hospitals. And we've had this data up for 3 years now. The first year, I think we had 16,500 hits. That's what Jorge tells me. Cumulatively now, we're up to 1 million hits. And we just got our data up, our updated data up last week, and we know we're going to get a lot more hits, and we'll have even more hits when we have this on our open data portal. But you'll see on our lower right that the rates of healthcare-associated infections in California are going down. And I think that it is in some way attributed to the fact that we have this data posted publicly now. As far as getting approval, well, we developed a really rigorous approval process. We had our data stewards, our subject matter experts. They actually self-nominated their data sets, and they filled out the data dictionary, came up with the metadata forms to ensure completeness and high quality. Then we had a second technical work group that would review all the data sets that were submitted. And they'd look at it from an EPI standpoint or statistical standpoint. Then once they approved that, it went over to the center deputy director and then to our executive team to look at the data from a public policy lens. And then we would send it to agency for sign-off. Now this process took about 3 months. And if you think about it, that's not that long in government time, okay? And we're actually finding out that we're able to streamline this process a lot more now that we've developed these standards. In fact, our agency has since really pushed us to get more data sets out. So now there's a real emphasis on making more of this data available. As far as no one will use it, well, we really found open data to be an opportunity for us to plug into the larger ecosystem. and reach those folks both inside government and outside of government. So we're looking at working with academia, with other governmental entities, the general public, the media, and civic developers or private for use of the data in private ways. One thing that we did last March was we connected with the larger community to have them help us with our portal. So we had our subject matter experts work with Code for Sacramento, and I want to thank Ash and his team for really working with us to improve our open data portal to make it much more user-friendly. We also sponsored a mini hackathon with the local hacker lab, and we got a bunch of civic tech folks to work on developing pilot applications. So within 2 weeks of having that soft launch in that hackathon, we saw this on GitHub. You saw people basically programming applications with the data that we had provided. One of the applications that was developed was Wicked, where our civic hacker friends basically took our data about WIC vendor locations, and they also took data just regarding eligibility for a WIC to create this little application to help you identify whether you might be eligible for WIC. They did that all in a week, okay? That would have taken months, if not years, for us to put together. So now the general public can go ahead, type in their address and see what locations, where the locations are for WIC vendors around them. This has been a real great service. I mentioned earlier the healthcare-associated infections. Well, like I said, the public can now drill down into various locations and compare hospitals against each other. And we're seeing much improvement in our healthcare-associated infection rates and other types of scores. And this is the soft power of data. I mean, the government oftentimes uses hard power. We regulate, we mandate, we citate. But the best way sometimes is through the power of persuasion and by providing the data so that people can make more informed decisions. To help make more informed decisions, we're seeing that the media is using our data. You'll see to your left, the New York Times has taken data related to vaccination rates in California to identify where there's high rates and low rates of vaccinations. In the middle, you'll see a local news media using our raw data and sharing that with the public. And then you'll see that CNBC on our right has taken that data and made an interactive map that can showcase the different rates by county. So as far as lessons learned, it really helped to get that seed money and that partnership, to have an agile, multidisciplinary team to work with us, to start out real small and incremental and build upon that success, but then to really develop a process and a structure to get that data out there. And also to engage the larger audience and the stakeholders to improve our product. So where are we now? This is where we were a year ago. In fact, this is where we still are in many ways. But now you can go to our portal, and you can see that the data is sorted in 6 categories. And so, for example, if you wanted to look at, well, what's going on with West Nile? What someone would do is they click on the box that says diseases and conditions. You'd find the data available, and you see the fourth one over there fourth one in the bottom is West Nile viruses. And then you can get the data. You can, if you want the raw data, you can extract it and put it in an Excel spreadsheet, or you can click to do a visualization if you want to just check that out really quickly, and you'll see a visualization here. And this actually was surprising for me, is you'll find out that West Nile largely hits, or the peak time is in the early fall. Now, I would have guessed it was much earlier than that. So now we're just one department within our larger agency, and our agency has really supported the expansion of open data throughout all the departments. So as Mike Wilkening had said earlier, OSHPUT has established its own portal. Agencies developed the portal as well. We also have DHCS that just provided data into the portal, and now I think we have 105 different data sets and visualizations up within the past year. Our agency has developed an IT governance where you'll see in the circled area, we have a separate group that's just working on data. And that's led by a number of CIOs and chief deputies working within our agency structure. This is our agencies portal, and we actually, as a department, liked how agencies portal looked like, and we've since adapted our portal to look much more like theirs. We've got some great data available in other departments like OSHPD, where they've gone ahead and incorporated not only their raw data that they have, but they put some visualizations right into their website to make that much more available. So we still have a long ways to go. We want to make the data much more usable. We want to be able to shop for data like you can shop for shoes on Zappos, because that's going to make it much more accessible for the public. We also need to do a lot more on data analytics. Once we have more data sets available, that's going to really help us make more informed public policy decisions. So to sum up, there's a vast ocean of data out there. So go ahead and jump in. Start small, no need to make big waves. You can then plug into the larger ecosystem to get ideas and get inspired. There's no need to start from scratch. And if you do so, you can work together, see your efforts ripple outward, and then engage the broader audience to get better public health and welfare outcomes. Thanks very much.